On March 28, 2025, Dr. Evan Kovac, Associate Professor in the Division of Urology and Department of Surgery at Rutgers Health, Newark, New Jersey, utilized VioMerce's VioVision XRS for the first time in patients. VioMerce's near-eye wearable display allowed him to perform a TURBT, TURP, ureteroscopy, transperineal fusion biopsy, and remote resident training without looking at OR monitors. The XRS consists of first-person 3D cameras and high-resolution see-through optics, which projected images directly to Dr. Kovac and his residents' eyes, allowing them to focus on the operative site throughout the entire case. Dr. Kovac wears the XRS prior to starting the case. The unique design allows him to wear corrective and X-ray protective lenses without sacrificing the 4K resolution.
I have a great view. I have a great view of the camera. It's beautiful. It's HD. I can see my hands at the same time. There's a little bit of a strictured area here, but I can easily pass it. I have a great view of the cystoscope, of the view of the bladder. Here's prostate, and here's his bladder. Okay, let's do a cystoscopy now. And I don't feel the need, I think it's important to note, I don't feel the need to look at the screen. Like I feel like, you know, I'm looking at a screen as I normally would with the headset. Like I don't feel the need to look up like that. I feel pretty, even though this is my first time doing this in the operating room, I feel pretty comfortable just like looking straight ahead, and I feel like I have a screen in front of me that is very useful. The fact, I will tell you something, Dr. Stone. I really like the fact that when I go in with the cystoscope, I'm not looking at the screen here to see when I'm getting in the bladder. I'm just like right there with my hands, you know?
How is the fulguration look of the eye?
Yeah, it looks fine. It looks fine. I could gauge my depth effectively. I didn't feel like it was inferior or superior to the screen, but you know, I'm right here with my hands all in line. I don't see that other specimen though.
How does it feel to your neck, not to be twisting your neck to the right?
Feels good. No, it doesn't, feels not bad. Like it's not negative, it's neutral, which I think is good. Yeah, it's almost as if I'm doing open surgery right now. I guess that's a good analogy. It's like I'm kind of doing open surgery. And all I had to do was just flip my eyes down like that, ever so briefly, and then right back to the operation, which is nice, you know? I think so, and also I think speeds things up a little bit. You know, once we commit this to muscle memory and getting the equipment set up, it could make things ever so much quicker because you're not constantly like, you know, going back and forth between the screen and your hands. So Alex, one of the things that you might notice is if you want to look left or right, sometimes you'll move your head left or right because it really looks like you're operating in the patient versus on a screen. So that's just something to note. Yeah, see there, I wanted to look more left and actually move my head a little bit more left. But what you really want to do is center your head. Very well. So I don't think I've looked at the screen once during this whole case. Of ureteric orifices, I find it helpful to have my hands and the screen right next to each other because it's so easy to lose vision of the orifice in these tough anatomy cases.
During the ureteroscopy, the urologist can watch his hands and also observe the image of the ureteroscope being passed up the ureter along the guide wire. This helps him manipulate the scope. Now he sees a stone because he doesn't need to look away at the monitor. This is especially important during teaching Dr. Kovac first trains a resident to perform a TURP in the OR. Next, Dr. Kovac watches and instructs a resident while outside of the OR. Not only can he see the same endoscopic monitor, he also sees the resident's hands and operative site. Dr. Kovac then instructs a resident who is doing a TURBT. This clip demonstrates how an instructor can use live annotations. When Dr. Kovac illustrates where to buzz, the resident sees the location in the see-through optics.
Good, we have resident training now going on.
Hey, you could be in another room.
I could be. I could be in your office. I could be. Not with this one, but I could be.
It's a little better.
That looks great. I wouldn't go more than that.
Okay.
I wouldn't go more than that. You could clean up some stuff. I mean, it was a little raggedy at 6 o'clock there, but I would leave it. So go back to the Veru for, yeah, you can get some bleeders if you see them. Go back to the Veru. Right there. Take a look straight up.
Pretty open.
Yeah, maybe a little bit at the apex there. Just be careful because you're almost past the Veru. And there might be a little bleeder at 12 o'clock. That's all. Looks good. Oh yeah, there you go. You got it. Now I would just buzz, look down a little bit. I would buzz a little bit over here. That looks great. That looks great. Well done. Okay, fantastic. And now zoom out a little bit. Let's see if you can find the trigone now. Let's see if we can find it. Look to your right a little bit, and I think it's along there somewhere. I think it's along there. I think the trigone is actually probably in front, like, I think this is the trigone, if I'm not mistaken. Come back a little bit if you can. No, don't extend your loop. Come back. Go back to the bladder neck. That's always the safest thing. Oh, okay, so that's bladder neck. Go inside the bladder neck. It may be just like a very high, yeah, I think that's the trigone there.
Okay.
Look to your left. Look more. To your left. Look more. Look more. Yeah, more to your left. Yeah, I think that's the UO there.
Okay.
Yeah, that's just a bleb. That's some bullous edema. I think that's the trigone. So I think you're okay. And make the adjustment and go right back to operating versus regaining my orientation by looking at the screen. And it's kind of like you're starting from scratch. You know, the scope moves forward. The thing you were looking at is no longer present in your field of vision. That happens all the time, especially during your ureteroscopy, where you're trying to keep an eye on the screen, the wire, everything like that. If you can look at everything in the same, 15-degree field of vision box, I think that does help. And that's what I found is the biggest advantage to this with regards to looking at your hands. It's not that you're looking at your hands, it's that you can look at your hands very, very quickly and not deviate away from what you're trying to do operatively.
So it's not really hand-eye coordination, it's more like surgical field orientation.
I think so.
Yeah.
That's how I would frame it.
It's almost like the first time you use loops, getting used to them.
Yes.
Having to look off field with the loops.
It's muscle memory like anything else.